In stage 4 of our fibromyalgia protocol, we're going to address sharp or stabbing pains. These pains are the result of elevated prostaglandin levels. Prostaglandins are a special type of hormone your body creates at specific sites of tissue damage and inflammation, usually from infections or direct physical trauma like an old injury. We often talk about inflammation as a bad thing, but it's actually a blessing that our bodies can even create it. When its cascade completes itself properly, it's the way that we heal from the inevitable traumas of life. If our bodies could not become inflamed after a wound or infection, we would never be able to repair ourselves and we'd just crumble like a rotten piece of old furniture. Fortunately, nature has imbued us with the ability to heal. Unfortunately, that process doesn't always go as planned. This image shows how prostaglandins are expressed during the inflammatory cascade. It starts with infection or injury, proceeds through an enzymatic process where prostaglandins are expressed, and finally to inflammatory cytokines, which signal the production of the classic signs of inflammation we always look for: redness, swelling, pain, etc. Many fibromyalgia patients report that during flares they have especially bad sharp pains at sites of old injury. Prostaglandins should be kept within a healthy and normal range, but sometimes they are elevated beyond that, which can trigger excessive amounts of pain. Women with fibromyalgia also often have incredibly painful periods, and elevated prostaglandin levels again are frequently why. Many people with any kind of pain will at some point in their life have tried medicines like ibuprofen or aspirin. These are inexpensive, over-the-counter pharmaceuticals which act as COX inhibitors, decreasing prostaglandin production. Unfortunately, they also come with a risk of dangerous side effects, especially when used long-term, and they don't address the underlying causes of the deranged inflammatory cascade which produces prostaglandins in the first place. That's where stage 4 comes in. The effectiveness of this part of the inflammatory cascade is largely influenced by two factors: how well your immune system is working, and how thorough is your body's circulation of blood to every type of injured tissue. The immune system regulates the inflammatory cascade, but if it can't get where it needs to go, the cascade may not work the way it is supposed to. The earlier stages of this protocol, especially stage 1, set the groundwork for what we're about to do with immune regulation and blood supply. In fact, if you've already been practicing the foot soak in stages 1 and 3, you've got a head start, and for some people, the stabbing pain of stage 4 is so mild they don't need to do anything at all other than get regular exercise, or occasionally use some simple topical remedies like Cordialis salve or evil bone water. For others, the sharp pains of fibromyalgia are the most severe kind, and deeper work at this stage is required. Like each other stage of the protocol, stage 4 is broken down into 3 parts: nutrition, a specific breathing exercise, and botanical medicines. And like each other stage, this information is meant to be used for educational purposes only and should not be taken as medical advice. Please speak with your licensed medical provider before beginning or modifying any diet, exercise, or supplementation plan. Nutrition for stage 4 is a simple and delicious expansion on what we've already covered. Eating a moderate, balanced diet of mostly cooked foods has helped your body recover from chronic infections, regulate its microbiome, and relax its autonomic nervous system. For stage 4, we're going to emphasize the importance of eating the rainbow of fabulously colored fruits and vegetables, and a treat I'll get to in a second. Richly colored plants are high in antioxidants, and especially vitamin E, which is essential for keeping prostaglandins, specifically the pain-regulating prostaglandin E2, in a healthy range. Vitamin E supplementation has also been shown in a randomized controlled trial to reduce menstrual cramps. This is why. Dietary sources of vitamin E are in many nuts and seeds and brightly colored things like spinach, avocado, bell peppers, beet greens, and pumpkin. By eating plenty of richly colored fruits and vegetables, you're also consuming a high level of dietary antioxidants, which are associated with healthier inflammation cascades and better cardiovascular function. Now, I know it's been a lot of hard work to get where you are with being ready for stage 4, and you deserve a treat. So I'm happy to let you know that in stage 4, dark chocolate starts to become truly medicinal. The flavanol content of dark chocolate not only has been shown in a randomized double-blinded controlled trial to improve vascular function, it's also a powerful way to increase nitric oxide, the signaling gas responsible for vasodilation and pain perception in most fibromyalgia patients. Traditionally, chocolate is said to be a rich food that can increase dampness. So as with all things, take this in moderation, and if your signs of dampness return, you may need a little break or to use a little microguard to help digestion. But a couple squares a day of a low-sugar, high-potency dark chocolate at this point in your progress may be a nice way to reward yourself and keep the blood flowing. And when we get to the botanical section of the video, I have a very special surprise in store for you. Almost any kind of exercise can get your blood moving, and for the sharp and stabbing pain of our fibromyalgia protocol, we find that regular, mild activity as tolerated throughout the day is the most important thing to do. Sedentary lifestyles are not good for our health, but are a common coping mechanism many patients with fibromyalgia adopt because their pain becomes so much worse with fatigue, or they suffer from post-exertional malaise. Now that you've completed stages 1 through 3, it's time to contemplate getting up and moving again. Setting an alarm every hour to do 5 minutes of stretches, going for short walks throughout the day, or engaging in regular movement practices like yoga, tai chi, or qigong are well studied for their beneficial effects on fibromyalgia fibromyalgia pain reduction. Clinically, we see these make the most difference with the least rebound pain in stage 4. And when you're ready to relax for the day, here's a simple breathing exercise that can help bring down your blood pressure and get your blood to your extremities so that your body can repair itself after activity. Lay down in a comfortable position in a quiet room. If you can lie flat on your back or with a couple of pillows, that's ideal, but really any position can work for this exercise as long as you're able to relax. I don't recommend doing it standing up. Just breathe normally for a moment, don't try to force your breath in any one direction, and notice where you feel your heartbeat. For most of us, it will be in the chest, maybe the neck or the head, but somewhere in the upper body. Just put your awareness on your heartbeat and sit there with it. Now take in a deep breath and start to sigh to relax. Very good. Place your attention of your body into the soles of your feet and the palms of your hands. Now take a deep breath in and sigh again. You may feel your heartbeat start to spread out, possibly into the shoulders, abdomen, or hips. Continue deep inhales and deep, relaxing, sighing exhales while keeping your body awareness in your hands and your feet. After a few minutes of this, you'll likely start to notice your heartbeat has arrived where you've kept your attention. If your mind wanders, no problem, just bring it back to your hands, feet, and breath. Once you feel your pulse in your feet, just take a few more breaths there. If you're sleepy after doing this, you have my permission to take a short nap. Otherwise, you can rest for as long as you like, or gently ease yourself up and go about your day. If you couldn't get the feeling of your pulse into your feet the first time, try this exercise again while doing the foot soak. More on that in a moment. Only being able to direct the pulse to your hands at first is very common. Some people will notice a little buzzing or some kind of awareness in their feet, but no pulse the first time they try this exercise. Don't lose hope if this happens to you. Just keep trying a few times a day. It really does get easier with practice. The final part of the stage 4 protocol is botanical medicines to relieve sharp or stabbing fibromyalgia pain. This is a stack of a tea, the Tibetan foot soak, a topical pain relief product, and that special treat I promised you earlier. The tea for stage 4 is called Buyang Huan Wu Tang. It originates from the year 1830 when the physician Wang Qingren developed it to treat patients who had circulatory and neurological damage following a stroke. It is still used for that purpose to this day in hospitals in China, and as a result, we have a significant reservoir of research into its pharmacological effects. We know that Buyang Huan Wu Tang can help stimulate the regrowth of damaged nerve tissue. It is also effective for helping to heal damaged blood vessels by promoting specific growth factors that affect their development. And specific to pain, we know that it has a powerful anti-inflammatory action because of its effects on nitric oxide. Nitric oxide is a signaling gas that has immense effects on our body's perception of pain and on the signaling of our blood vessels to expand or contract, allowing for blood to flow smoothly throughout our bodies. It is the uniting factor at every stage of the inflammatory cascade and needs to be kept in that Goldilocks zone. Not too much, not too little for this process to function. The architecture of this formula is a brilliant combination of a large dose of astragalus and a small combination of herbs known for improving blood circulation headed up by Dong Quai. Astragalus is a nitric oxide donor, or as Chinese medicine calls it, a qi tonic. It is capable of boosting energy and function of many systems of the body dependent on nitric oxide function, and it is especially famous for its effects on increasing white blood cell count and speeding up wound healing. It is especially useful in people who frequently catch or easily catch new colds, or have been hit multiple times with viruses such as SARS-CoV-2 that may have left them with depleted T cells, as astragalus can promote mitogenesis of this specific cell type. Astragalus is a very powerful herb, and one thing we always consider when administering it in the clinic is the timing of its use. It is not appropriate to take astragalus in most situations where there is an active infection or where excess pathological dampness is present, unless done by a trained and experienced professional. That's why those situations have been addressed in previous stages, so hopefully you're ready to use it safely now. Nevertheless, if you catch a cold while taking astragalus, it's best to stop and go back to stage 1 until you're well again. In stage 3, I promised you I'd speak again about Dong Quai, and I'm going to come through with that now because it's the second most important ingredient in Buyang Huan Wu Tang. Dong Quai is the most famous herb in Chinese medicine for women's health conditions because of the importance of regulating the menstrual cycle, particularly in soothing painful periods, to address whole body health for women. Modern research has shown Dong Quai to be a powerful COX-2 inhibitor which suppresses excess prostaglandin formation, specifically what we are addressing here in stage 4 to decrease sharp and stabbing pain. It typically comes without the harmful side effects of nonsteroidal anti-inflammatory drugs and is safe to use long term. The Tibetan foot soak again is used in stage 4 for its blood moving properties, properties, and I want to highlight again here the specific action of a couple herbs in the formula we haven't discussed before. Tibetan saffron is an incredibly rare plant with a very special set of medicinal actions. While it's usually known only as a fragrant spice for delicious food, in the foot soak it is employed because of its powerful capacities to enhance blood flow, reduce pain, and reduce unhealthy levels of vascular inflammation. For anytime topical pain relief, we give you a choice of two of our favorite products. The first is Evil Bone Water, a powerful remix of the traumatology classic Zhenggu Shui. This will be a good choice if your stabbing pains are severe or if you have lots of easy bruising or painful joints. It does contain some menthol and camphor, which are excellent for pain relief. They even have FDA approval for this purpose, but the aroma isn't for everyone. So we also let you choose the Corydala salve if you prefer. This is more gentle in its action, but has a milder scent and is good if you like to massage topicals in a large area of your body. And I promised you a special treat, so here it is. I'm standing behind my words of recommending dark chocolate as a part of this healthy diet during this stage of treatment, and I want you to be able to enjoy it without building up any dampness that you worked so hard to get rid of in stages 1 and 2. So we're gonna send you some in the stage 4 kit. This is a high quality, and I have to say, delicious hot chocolate mix made from high flavanol dark cocoa, and it includes some of the highest quality medicinal mushrooms from one of the most reputable companies in the industry. The mushrooms have tons of benefits on their own, and speaking as someone predisposed to developing dampness, I am happy to report from my own anecdotal experience that this hot cocoa mix sits very well and is easy to digest. For most people, stage 4 will be the final round of therapy they require, but hear me out because life can throw us some wild cards and it is best to be prepared for them. Freedom from fibromyalgia pain, from IBS, from many other symptoms of chronic illness is called remission, not cure. Remission can be and often is permanent, which is wonderful, and it may feel like you're cured, but it would be disingenuous of me to claim that this will be the case for everyone, so I want to take this opportunity to teach you how to take care of yourself in the future if your pain or other symptoms return. In the clinic, I have seen relapses from some specific causes: exhaustion, prolonged episodes of heightened stress, and new infections or activation of the immune system are the most common ones. Catching a new virus or a reactivation of an old virus like Epstein-Barr can trigger a relapse of fibromyalgia pain. If the pain that arrives during this flare is only wandering and heavy in nature, usually a one-time repeat of stage 1 is all that's necessary. But if other kinds of pain arrive, please review the videos appropriate for that stage and treat yourself accordingly. I have also seen this happen on occasion from people receiving certain medical treatments, undergoing surgery, or receiving a vaccine. This isn't usually a reason to avoid necessary treatments or vaccination, but it can be a valid concern to bring up with your doctor to see what alternatives are available or to be able to make advanced plans to honor your body's needs after undergoing that kind of procedure. Often flares resulting from these events are less severe than from contracting a new virus. If they persist, utilizing the appropriate stages is typically all that's necessary to go back into remission again. And above all, treat yourself gently. Be kind and compassionate and accept your own limitations. Our human nature as generous caregivers who want to take care of others is also often to overextend ourselves and deplete the reserves our bodies need to keep us free from pain. I hope you've enjoyed watching these videos as much as I've enjoyed making them. As always, if you have questions or comments, please let me know. I'm going to keep making fibromyalgia content too, so I'd love to hear your requests for future video topics. Be well.